Hello, my name is Robert Varnam. I'm a GP in Manchester and I'm Head of General Practice Development at NHS England. And we're here today at the NHS Citizen Meeting talking about, amongst other things, access to general practice and access to primary care more widely. This is a theme which the NHS Citizen Assembly in September raised as a big interest of people and a big concern that citizens and patients have about the ability to access the right care. And it's something that NHS England have also been taking very seriously and increasingly so over the last couple of years, prompted by a number of things. There's evidence that patients are finding it more difficult to get access to a GP when they need it. We know this from not just anecdote, but our regular surveys of patient experience confirm that although satisfaction is very high with general practice, the area of accessing services is a particular one of concern for patients. But concerningly for us, it's also one where satisfaction appears to be falling year on year over the last few years. It's also one where there's the greatest variation between different parts of the country. And so it's been on our radar. The NHS Citizen meeting last September really helped to not just add weight to the calls for taking access seriously, but also beginning to identify some new themes and helping us to go beyond the traditional surface of our national statistics to ask more questions. So we've been doing that. We've been asking more questions of the national data. We've been asking more questions of local leaders and innovators as well as their local communities. One of the things that I do at NHS England is I help to run the learning community within the Prime Minister's Challenge Fund on improving access to primary care. And this is something which the government asked NHS England to run. And we've been working with 20 groups of GP practices who are collaborating with other providers in health and care, so working with care navigators and pharmacies, with 111 services and a whole host of other people to try and improve patients' experience of access to general practice. We've also been doing some extra analysis of the national survey data, and we've also had a really productive meeting quite recently with the NHS Citizen programme to talk more about primary care and access. And what's helpful is that all these different pieces of work that are going on are coming up with some fairly consistent messages which we need now to talk more with citizens about and to find some new approaches for. The biggest things people have been saying to us are, yes, access is important, but we've taken often in the past quite a simplistic understanding of what it means to improve access. We've had quite a one-size-fits-all approach where I get sick, I see the doctor, I go away again. And patients are telling us that that matters, and recent workload pressures and workforce challenges in general practice appear to have made that more of a problem. That's why it's hard to get to see a GP. But only partly, because the other thing that's happening is that people's care is getting more complex. The people with the greatest needs actually don't just get sick and don't just need to see a doctor and then don't go away again. We need to be recognising that one size doesn't fit all, that there are different people in our society with very different needs and preferences, and we need to be coming up with solutions, with approaches to improving access which recognise the diversity of need that people have. And we're being encouraged very strongly, whether it's from local patients who are collaborating with their GP practices, or those GP practices themselves telling us what they think they need to be providing, or citizens. They're all saying, end the one-size-fits-all approach. Also, if we're going to drive that kind of change nationally, we need to be thinking about how we, as commissioners of this healthcare, can support, promote and incentivise much more collaborative working. Because it isn't either just about providing more access to GPs, it's about helping the system join up better to get the right care from the right person at the right time in the right place. So that's been really helpful. I think it's been a challenging few months for us at NHS England because this issue has really exploded and it's become a lot more complex than people have ever treated it as before. But actually that gives us optimism, because it's starting to sound like the questions we're asking are much more aligned with what people need. We're asking, how do we understand different needs and provide different services? We're asking about how we join up services and allow them to be much more effectively coordinated for people. And that's not just about providing a better experience for patients and users of services, it's actually more efficient that way. We waste a lot at the moment through things being too separate and patients having to sometimes make multiple contacts to get a problem dealt with. So we're broadening the issue, but it does feel as though that's the right thing to do. And today's citizen meeting is going to be really helpful at going to the next level, I think, in discussing with the public what good looks like and what providers, practices, professionals can do to meet those needs, and what NHS England and our partners nationally can do to help support that, promote good practice, enable the system to work better, and to incentivise it in the contracts that we hold.